Hello and welcome to the PCN Network Contract DES update after the new DES came out in October of this year, 2024, to ensure that we are updated and fully understand all of the differences that have happened since April. We're going to run through a few changes that have happened within the global sum rises that have come through, and also the changes that have happened to the PCN network contract from October compared to those that happened back in March, ready for our April start. So you will possibly have attended some contract webinars, masterclasses that were put on back in April, where we went over all the changes that had happened in the GMS contract, the PCN DES, and various enhanced services. And those changes we thought would be the end of it for 2024-25. But we've had some new and very positive changes that have come through in October, and GP Excellence wanted to get that information out to you as quickly as possible to ensure that you could take full benefit of everything, and also to ensure that you understood and made sure that you were getting financially compensated in the exact way that is intended from these updates. So our initial update happened with our GMS funding and the changes that came through. And that came through fairly quickly when we had a new government come into power. And our global sum was updated to £112.50 per weighted patient. And this was backdated to April. So you'll remember that originally, if we look all the way back to March, we were actually receiving £104.73 per weighted patient. We had an uplift of 2% in April, and then a second uplift in September. And this has now been this was backdated back to April. And you'll start to see those backdated payments coming through on your monthly statement. And these are actually come through as two separate payments. And the reason for that is because your weighted list size is altered once a quarter. So we had to do a backdated payment for April, May, June, and then re-looking at your patient population to see how many weighted patients you had for July, August, September. And then from October, you will see that regular amount of £112.50 per weighted patient, and that will follow through monthly, changing each quarter if your population amounts change within your individual surgeries. Now, I know one thing, that when this money came through, there was an expectation from the government that this money was used to give your staff a little bit of extra money. And that was considered to be, as it was over a 7% rise, that there should be enough to organise for most surgeries a 6% rise for their staff. And the extra money that came into that would be to cover on costs. And those on costs are your employers' national insurance payments, and also, of course, pension uplifts, because each time pay is uplifted, there's a little bit more pension that needs to be paid. We are, of course, unaware at this point, depending on when you're watching this, of what will happen at the end of October budget, because that may affect the national insurance contributions. But at this stage, when this was recorded, we weren't aware of any changes at the time. So the easiest way to work out how much money you have available if you are uplifting your staff pay is to take that March global sum payment of £104.73 and look at the difference when it is now up to £112.50. We can look at that as the figure because that was backdated to April. So even though it didn't come into play until September, as the payment was backdated to April, we can look at the full year. So to work out your total personalised uplift for your particular surgery, you need to look at what the increased amount, £112.50, is, minus the original amount, which was £104.73. And that difference for everybody is £7.77. So to work out for your particular surgeries, you just do £7.77 times your weighted list size. That will give you the amount that you are going to be uplifted. And therefore you can start to work out how much it would cost to uplift your staff's pay, keeping in mind any uplifts that you've already given back in April. Many people who aren't, say, perhaps on Agenda for Change have had to increase their staff wages at the lower end of the scale. So that might be your receptionists, admin, or even HCAs, due to the national living wage uplifts. So you need to take into consideration anything you've already given when working out some figures, and then work out your percentage if you're giving that to your particular staff members, obviously going through your partners and making sure that they are happy with those choices. If you do have a line in your contract that suggests from DDRB reasons, you have to give a DDRB uplift to your salaried GPs, that's where you'll normally find the line in the contract, then you do need to give them the 6%. That's not up for negotiation if it's contractual. So hopefully that's helped you a little bit with the funding situation with our GMS uplift that we received. And then we're going to look at the DES. So as far as the DES, there is quite a few changes financially that are coming in, and then a small amount of changing with the ARRS roles that we are now allowed to hire different ARRS people, and that will be general practitioners, GPs, for the first time. But there are a few rules around that. So we thought it was really important that we came out to you to make sure you had some understanding of exactly what's available in this new improved DES and how we can utilise that to better improve our own PCN. I have done a guide. Any of you that have been on my training sessions before will know that my guides come out to you like this. They're not the glossy NHS England guides, I'm afraid. They are very much a working practice manager's document that I've made for my own surgery and organised so that this may help you to understand the differences and the changes that came in first in April and then again in October, changes compared to them, so that you have a full understanding of the DES, making sure, although this works within each of your individual PCNs, so that you understand if you are getting any finances that are agreed across your PCNs and these are coming through as expected. So we will work through all of the changes in this next sort of 20-30 minutes. So we'll start with the core payment. So your core payment has been uplifted. Some of you will remember that things started to move last time within the DES back in April, and different things were moved into different payment areas. So for instance, things that we had previously, such as clinical director pay, leader and management pay, those were all moved back in April in the initial DES into our core payment, increasing our core payment at the time. It has now been uplifted again by a further 4%, and that has been backdated to April. So your PCN lead practice, or if you're incorporated, your PCN incorporated company will receive a back payment for your core payment backdated to April, as well as an increase going forward. So the increase has now been put in at £2.967 times your registered PCN list size. And let's remember that our PCN list sizes are called adjusted list sizes. So that is not your weighted patient, it is an adjusted list size. And those adjusted list sizes are actually looked at only once a year. So not quarterly like your GMS statement, but annually. And those list sizes are looked at the 1st of January. So that would have been looked at in January 24, updated originally in April 24, and now we're in September or October, and that is now being backdated back to April. So we are looking at a few changes that have been put into place with that backdated pay, but the changes of the 4% are 4% over and above what we were given in April and not last year. Hope I haven't lost you there, but things are moving and changing. So we are looking at that new amount of that 2.967 times your registered adjusted list size within your PCN, giving you that little bit of extra money coming in. So that should be going through to your PCNs and hopefully being fed out to practices at some point. Payment that hasn't changed in all the years of the PCN DES, and we've finally got an uplift that's come through in October, and again backdated very fortunately to April, is a rise in the nursing home payment. So this is the payment that you receive for each nursing home bed that you have within your PCN. And there was a 6% rise, taking us up to £127.20 per nursing home bed in your PCN. And as that's backdated to April, we will have a little bit of extra money coming through with that backdate, and a lump sum should be coming through to your PCN accounts. However you deal with or discuss your PCN care home or nursing home bed payments is individual to each PCN, but you will be aware that that money should be going in. Enhanced access, again, we've had a nice little increase, and it does say nicely on here exactly how to work that out. So your increase is now, the new rate is 7.975 times your adjusted population per annum, and then you can work that out per month. So we can look through at our enhanced access, see what amount that you are entitled to get due to your population size. Obviously, some people do actually get other services to provide their enhanced access, and at that point that would be a deal you would be making with them if there is an increase for them. If you do your own enhanced access within your PCN, working weekends and evenings, at least you'll see a little bit more income coming through, which should help and assist with the finances going forward. So hopefully that's good news for everybody. There's a little bit of controversy with the differences going forward with our staff ARRS rises that have come through. So we have been fortunate enough to see a rise that will be coming through to give you a little bit more extra money to uplift your ARRS staff's pay. As you'll be aware, your PCN staff money changes in October normally, so this has come through. It's come through a little bit better looking than it normally does, but unfortunately there has still not been an uplift to the total amount of ARRS money available for each PCN. So what that means is you have a large pot of money for each PCN, which is very much dependent on the size of your PCN. And that amount of money is the amount that you can divide across all of your ARRS staff when you take them on. But your ARRS staff are each committed to be paid within a specific banding when you go on the portal. And the amount that you are available to claim back for your ARRS staff includes not only their pay, but obviously their pension payments and also their national insurance employer's amount. So it's the total cost to the employer that we can look at. As you're aware, and there's been some talk about this in the past, it doesn't quite match up with Agenda for Change. So we have been given sort of an Agenda for Change idea of which banding these particular staff should fall into. But the money that is covered doesn't actually cover you right to the top of the banding, unfortunately. As any of you that do work on Agenda for Change amounts within your surgery, you may realise that there are some added extra bandings within the banding. So the bandings of 8A and 8B used to only be adjusted after 5 years at that level. There is now a midterm adjustment after 2 years, which would mean that if you start uplifting your ARRS staff and paying back to April, you will have to also look at those extra adjustments if you have advanced practitioners within your team, because those payments will hit in there. So there are new available amounts to claim. These are not going to be backdated, sadly, to April, which would have been very useful, but unfortunately they're not. They will just be paid at these new amounts from October to year end. And the reason for that is it's very difficult to go back when the claim is going through a portal, and to try and organise and arrange back payments for staff that may have moved on or left can be very challenging. Because we are looking at staff member by staff member, as each PCN works very, very differently. So there is, within the PCN DES, if you do get the new copies, there are 2 different documents, and in one of the documents it does go through basically what's on your slide here, which is the difference in all of the payments, and it will show you what the payments were back in October, your maximum payments that you could claim for each specific role. And then it shows you again the maximum reimbursable from October, which, as you can see, has got quite an increase in there. And this can help you to retain your PCN staff by uplifting their pay for cost of living increases, and hopefully that will give you a little bit of money to do that. Again, it's a totally PCN decision on how you work with your ARRS staff. If you do follow Agenda for Change, you will be expected to match those Agenda for Change payments. If you do not follow Agenda for Change and you have set fees, then you can work out in pretty much the same manner we discussed earlier for your regular staff and how to work out uplifts. You can do the same with your PCN staff, looking at the amounts available. Please, when you're doing that, don't forget those on costs, because we do have the extra pension and the national insurance amount to work out and decide exactly that needs to be taken into account when you're increasing any ARRS staff payments, because that's all you can claim on the portal, a total cost. So hopefully that's been a little bit useful. There are also some increases for our mental health staff, where you will potentially be working alongside the mental health authority within your area to hire those staff, and therefore you only get back a percentage of their wage, because you only are expected to pay towards half of their wage, and half of their wage will be met by their initial employer. So that's your mental health practitioners. And the thing that changed back in April and has continued through in the October PCN DES is that the maximum reimbursables now start for your mental health workers all the way back to a band 4 equivalent. If you go through the April's version of the DES as opposed to the newer version, and this was discussed back in the contracts class, each of these different bandings have different allocations of what is expected of them. So these are generally done in Agenda for Change bandings, because they are normally set by your mental health authority within your area. And those Agenda for Change prices will then be fed through at 50% to you. And they do have very specific things they're allowed to do within their roles because of their banding. So this isn't a choice from GP surgeries or PCNs. This is what's decided by their employer and then fed across to you at what is acceptable to do at those specific bandings and the amount of patients they are allowed to see at that specific banding. So that's there for you with the updates. And again, that can be found in the DES at these amounts. So I've copied and pasted that into here for you so that you can find those figures easily without hunting through those 2 rather large documents that came out. And the biggest change that we've all been waiting to see has been the GPs being added to the ARRS roles. Is very, very specific criteria around this, and they are not added into your ARRS allocation of money that you already had, but there is a ring-fenced separate ARRS allocation that is purely for GPs. So if you don't hire a GP using this money, you can't use it for something else. You can't take on an advanced practitioner, for instance, or something and use this GP money. It has to purely be for a GP. At the moment, it is based on a 6-month period, October to March 25. It is we've been told that it is extremely likely to be rolled over, and Wes Streeting, who is in charge at the moment of the NHS and as Health Secretary, has stated that this money will roll over to next year, so we don't have to be concerned about taking on a GP. It's been made extremely clear that you cannot take on a locum for 6 months and use this funding for a locum. It is only available if you take them on within your PCN as a specific ARRS role GP that is salaried and attached to you. As I say, there's quite a few rules around this. So as I mentioned, the funding will be ring-fenced, and this is very much dependent on the size of your PCN, and we will go through that in the next couple of slides. The GP may not have been substantially employed as a GP in general practice unless you get very specific agreements from the ICB, your commissioners. So what that means is if back in August, when a lot of the trainees came through and passed, if you took on someone then as a salaried GP, you cannot backdate and say, actually, I want that to be our ARRS role, because they are already in place. But they have said on some occasions, if you go to the ICB and make a case, they may allow this, but you can't just simply start adding staff that are already working for you as a GP onto your ARRS portal. And the reason behind this is because the idea of adding GPs to the ARRS role is because they don't want unemployed brand new GPs sitting there waiting to be taken on. So they want you to increase GPs within general practice by using this funding. And that won't happen if you're using it for a GP that's already working for you. Your GP must be taken on, as we mentioned, in a permanent capacity and not in a temporary, such as a locum capacity. The GP must be a newly qualified GP. What they're classing as newly qualified is under 2 years since the completion of their training. So if they have qualified within the last 2 years, you are allowed to take them on. If you have a senior GP or a retainer GP, that is not covered by ARRS, so that will not be allowed. The GP, as we would expect for any GP, must not be prohibited from performing services via the National Performers List and must not be suspended or subject to interim suspension. So that's standard recruitment. We shouldn't be taking on people who are not qualified to be working, but they've just made sure that that is there within the DES just for so there is no doubt. They must be employed in terms that are no less favourable than that of the BMA model contract. That's fairly standard with GPs. We do normally have to employ with terms that are no less favourable than the BMA model contract. So that is something for you to have a think about and make sure that you have covered everything. That includes their sick pay, their annual leave and all other contractual requirements. Obviously, some new HR rules have come out at the moment in the last few days as I'm recording this in early October. So things could change anyway within the BMA model contract. So we need to keep an eye on that and make sure that we are working legally and correctly due to the new HR rules. So your GP money that will be available during ARRS for your reimbursement will be based on your size of your PCN and will, as we mentioned earlier, be ring-fenced to make sure that is just for ARRS and nothing, just for GPs within ARRS and nothing else. So no advanced practitioners to be using this money. It is purely for a GP. It is at the lower end for what most of us will pay for a GP. It does match that's stated in the BMA model contract, and it's very difficult to get a GP that will work under those amounts. I know they're normally far more expensive. So you're looking really at a full-time equivalent GP at 73,000 per annum. Because the funding works out for a full-time equivalent GP at only 94,000 including your on costs. So again, that's your pension payment and your national insurance employers' costs. Obviously, you can choose within your PCN to make up to a higher amount if that helps you with recruitment, but you won't get that reimbursed. So that is a discussion that you need to have within each PCN. So the amounts that are available are listed here for your separate PCN sizes of population sizes. And that will be different amounts depending on your sizes. So for instance, a PCN of around 50,000 patients, you'll get around 65,000. So it's a less than full-time GP for a population of 50,000. You can take on a GP in sessions. So you could be looking at a 4-session or a 6-session GP, depending on what fits the bill for you. And that is to be shared across the whole PCN. So it's probably worth having a really good think about how you could utilise a GP to work across your PCN and do everything that's required without them necessarily working within each surgery for a part of the time, because that could be really challenging for them if they're going to have to go from surgery to surgery with different ideas and different rules. There are a few ideas out there that you could utilise these GPs for, possibly for your nursing homes or your residential homes as that care home GP, that we do have to have a care home lead. So that's one possibility. Or you can think about something very specific, such as a visiting GP, or one to do very specific, maybe group consultations or separate consultations in a specific area that works for your particular PCN, depending on your type of population and the cohorts that you look after. So you might, for instance, think about a GP to run a respiratory hub, or one to work for it in a diabetic hub, where all of your PCN can go into, or they may run group consultations for you, or look at research. There's all sorts of different things that you could look at for that GP, depending on how many surgeries that you have and how you want them to work. But you are going to be limited with sessions at the moment. We are expecting that hopefully to change and increase going into next year's DES, but we'll have to wait and see what happens with that. But hopefully this is really good news for everyone, that we are going to be able to start looking at taking GPs within ARRS, giving those newly qualified GPs an opportunity to have some employment within PCNs, and then work forward with them, embedding them within our PCN or our practices. So I hope that's been a useful catch up for you. These are your main PCN DES changes for the 24-25 October version of the PCN update. And as I explained at the beginning of this talk, there will be a piece of paper, a piece of work, a handout that has been made for you that will summarise all of these changes with all of the figures in them to help you work out the maths that's involved, how much money extra that will be coming through your PCN, and what's available for you looking at those specific ARRS roles within using GPs. You may remember, if we look back to April, and the changes that came in then was the enhanced nurse at a band 7 that was added into ARRS. And there's also this allocation of a non-specific ARRS role, where you can actually utilise and make a role that you have to then have approved by your ICB for payment to add into your ARRS. That one I'm not so sure. I haven't seen many people do that particular role. At the enhanced nurse, you're allowed 1 per PCN. It's a little bit of a challenge to get someone in place, but again, this is a useful role. So we are starting to see things pan out, with nursing now being involved a little more. Those advanced practitioners, the cap has gone, so we can utilise those within our main ARRS budget, and now this separate GP ARRS budget, alongside all those nice little financial inclusions that have come in to assist us. But do make sure that you are checking and looking for that back pay for both in your global sum for your particular practices and also within your PCN accounts to make sure that you've had that back pay for the core payment and for your extended access and your care home beds. That's quite a little bit of extra money that should be coming in. And then do have a look at the different amounts that you can pay or claim back for your ARRS staff, and to see if it's worthwhile looking at an increase for them to help retain staff within your PCN. I really hope that's been useful. Hopefully you'll be able to achieve a copy of the handout and the slides. There will be information given to you by GP Excellence that will tell you how to go ahead and get those things. And I just hope that's helped a few of you understand the new PCN DES and help you through some of those changes that have come through. Thank you and have a lovely day. Goodbye.